Good morning again, everyone. My name is Tina Hall with Era Living. And before we start today's presentation, I would like to introduce the Community Relations Director, Ike Elmo, who would like to say a few words about University House Wallingford before we get to our main event. Ike?
Thank you, Tina. In affiliation with the University of Washington Retirement Association, University House Wallingford residents benefit from the partnerships developed with the University of Washington Schools of Nursing, Social Work, and Pharmacy to deliver innovative programs designed with healthy living and lifelong learning in mind. If you are considering making a move to a retirement community, you are welcome to arrange a visit and explore everything we have to offer at University House Wallingford. We'd love to have you. And we'll talk about different health options and how our wait list works. And now on to our main event. We are pleased today to have with us Dr. Abby Winter, who has joined us today to present on vitamins and supplements. Dr. Abby Winter is a licensed pharmacist and clinical assistant professor at the University of Washington School of Pharmacy, and serves as the director for outreach for the Klein Center for Geriatrics. Dr. Winter leads the educational, clinical, and outreach efforts for the UW School of Pharmacy at the Era Living communities. Thank you so much for joining us today, Dr. Winter. Welcome.
Thank you. All right, if I could get a thumbs up, just making sure that you can see these slides all right, we can get going. Looks good. All right, thank you. Well, thanks everyone for joining. As I said, I'm Abby Winter. I am a pharmacist first and now an educator as well at the School of Pharmacy. And as he also mentioned, I do a lot of outreach at Era Living. So I go to all the communities and provide clinical services. So I'm available for consultations if you have questions about new medicines or if residents just want to go through all of their medicines, things like that. So it's a really awesome opportunity and kind of a unique setting and a unique offering that Era Living has. Today, as we said, we're going to talk about vitamins and supplements. There is a lot out there, and folks are often confused about the existence of any data or supporting the use of these products. And so what we'll do today is talk through any questions that you might want to ask yourself when you're choosing whether or not to take a product. If it is deemed appropriate for you to take a product, we'll talk about how to select appropriate vitamins and supplements. We'll discuss the various media attention and advertising that happens around herbal products as well. And then a few recommendations just in general for older adults with vitamins and minerals that you may need. I do have a quick note here. I did have a pharmacy student of mine help and develop some of these slides. So I wanted to give Michelle a quick shout out. She was very helpful. So first, let's talk about dietary supplements. As we know, a picture's worth 1,000 words, right? And I think this picture's pretty great, showing how supplements are essentially part of our diet and might be something that we're using to supplement our diet, which is,
of course, turn the volume down a bit.
Which is, of course, where that the term supplement comes from. So what is a dietary supplement? It's a product that contains a quote unquote dietary ingredient that's meant to provide additional nutrients to your diet. And I think the important thing here is additional nutrients. So we want first and foremost to get these things from our diet whenever we can. But dietary supplements are helpful if we need additional vitamins, minerals, maybe amino acids, which are essentially the building blocks for a lot of the things in our bodies. If we want additional herbs or maybe enzymes as well. There are a ton of different formulations. If you step into the pharmacy or the drugstore aisle, you'll see that there are pills, there are powders, there are nutrition bars, a bunch of different options, which can be really overwhelming, especially when we see here that there are over 85,000 types of different supplements sold in the United States alone. So where do we even begin? So that's what dietary supplements are. What are they not? They are not intended to cure, treat, or prevent any illness or disease. And they're not allowed to claim that they can either. So we want to consider, is it your understanding that dietary supplements are proven safe and effective effective before they end up on store shelves? A lot of folks think if it's at the pharmacy and it's on the shelf, certainly it's gone through some sort of testing. But did you know dietary supplements do not need to be proven safe and effective before they're marketed to the public? I think that's kind of scary. It should raise an eye and give you kind of a red flag that if I'm selecting a product, I might need to pay a little closer attention. I need to be a savvy consumer and make sure I'm not putting false trust into some of these products just because they exist on the pharmacy or drugstore shelf. Now ask yourself this, yes or no? Do dietary supplements undergo FDA, which is the Food and Drug Administration, FDA approval the way that OTC products do? And so an OTC product is like your allergy medicine or a cough and cold product or a pain reliever like Tylenol or Advil. And so the question, do dietary supplements undergo that same sort of approval? They do not need to be tested in clinical trials, which is another example of why it's really important for us to be savvy consumers. Do you think that manufacturers of dietary supplements are required to put safety warnings on their product labels? One would certainly hope so, but did you know manufacturers of dietary supplements are not required to put safety warnings on their product labels? That's pretty concerning, especially because we know that some dietary supplements are not always safe. Even though we think if it's available at the pharmacy and I can just grab it over the counter, certainly it's safe. We hope that that's the case, but it isn't always, especially if you're on other drugs or products. There's a chance that these could interact, or there could be some concerns with medications or health conditions that you have. So again, we need to be savvy consumers. Dietary supplements are not drugs, so they are regulated differently than our over-the-counter drug products are. So those cough and cold, allergy, pain medicines. Dietary supplements are not considered drugs. They're considered special foods. And because of that, they are regulated quite differently. And that's important for us to keep in mind as well. So you might see products with claims on them that seem like they're trying to claim that they treat or prevent or cure an illness. But if we take a closer look at these products or at these claims, they're really tiptoeing around the topic to try to still follow the laws that exist. So for example, a supplement product can, quote unquote, help support your immune system. Someone might interpret this as saying, oh, this is going to treat my cold, or this might prevent me from getting a cold. But we dig deeper into that and see all it's saying is it's helping support your immune system. There's no real claim to a true health benefit necessarily associated with that product. Disclaimers must always be present on these products and accompany these claims, stating that the FDA has not evaluated them. But often we don't see those FDA warnings on there. We just look at the thing that they're trying to make flashy and promote to us about how it helps my immune system. But this is the warning that must accompany the FDA, or that must accompany those claims. And this is from the FDA, stating these statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. It's important that we keep an eye out for these warnings. They exist to help keep us safe. So let's look at a few examples of these claims and how we might misinterpret them or interpret them the way that the manufacturer hoped we would, but think about how they may or may not actually be providing the benefit that we are misinterpreting them to provide. So this first one is a healthy fiber supplement that says it improves regularity and growth of beneficial bacteria. It also has an asterisk there, which means it would have the FDA warning probably somewhere on the back saying the FDA didn't approve this, the FDA didn't look over it, they're just making this claim on their own. But we don't see it on the front of the bottle, right? We've got to turn that bottle around and look for the small print to find it. So someone might see this and say, oh, this is going to maybe cure my bowel concerns and help with the gut bacteria. Maybe, maybe not. And it can't make that claim. Here's another example with biotin, which I think is a super common one that folks like to take because there are a lot of claims out there that make us think it's going to be really helpful for supporting our healthy hair, skin, and nails. Which there's a lot of anecdotal evidence that biotin can help with this. They also add in this extra little one of energy support. Well, what does that even mean? Someone might look at this and say, energy support. Oh, great. I feel tired. This will help with my energy. But what does energy support really even mean? So this is just another plug to help you be a more savvy consumer. Think twice about what you're reading and not just looking at that one word and say, energy. Yeah, I want energy. Maybe this will help, maybe not. And knowing that the FDA has not made that true claim and has not assessed it is important to know when you are trying to select a supplement. Another one, this glucosamine chondroitin. I think that's a pretty common one, especially as we think about our joints being achy, or as we age, sometimes we have increased joint problems. And this glucosamine and chondroitin supplement is claiming to cushion your joints and support movement and helping to promote healthy cartilage. And again, they'll give you a warning to go back to that FDA warning, but they don't make it super prominent. So there may be some data to support this, but it's important that, again, we're trying to be savvy consumers. So there are some potential concerns with dietary supplements that I've sort of alluded to, but let's talk about those. First is the chance of incorrect labeling. So because there's no testing and there's no FDA regulation or anything like that, the amount of the ingredient that actually exists in the product may be different than what's listed on the product label. There could be more, there could be less, maybe even none. That we hope is pretty uncommon, but there's a chance that maybe it says there's 400 milligrams. And if we took that product to be tested, maybe it's only 200, maybe it's only 100. So are you getting your money's worth with what you think you're purchasing? That's important to keep a thoughtful assessment of. Next is contamination. So some products may be contaminated or contain different ingredients. There are some times where they have looked at these products after they've made it to the store shelves and they test them with a third party to say what's in it. Does it have what it says it claims to have? Are there other ingredients in there? And many times we find that there are other ingredients than what's actually written on the label, which can be really scary. I see some things coming up in the chat like, well, then what am I supposed to do? Is this going to be helpful? What product can I purchase? And don't worry, we will touch on how to find the appropriate safe products for you in just a moment. Some other potential concerns, quality. So depending on the product or the manufacturer, the ingredients may be made in a lab, they may be sourced naturally. So figuring out what is more important to you can be important when you're trying to select a product as well. So overall, I want you to know that dietary supplements are not always risk-free. There are definitely ones that are safe and some that might have some data to prove some effectiveness, but looking at them as a blanket statement of being safe and effective is not quite the way I want you to go about this. So let's think about what questions do I want to ask myself if I'm deciding first if I should even take one of these products. If the claim on the bottle for the supplement sounds too good to be true, it probably is. If there's a claim that's saying it's, the fountain of youth, wouldn't we all take it? If there was a magic weight loss supplement out there, we would all be super skinny, and those aren't always good things for us. But if something sounds too good to be true, it probably is. Again, we'd all take it if we had these magic pills that were available. I alluded to this a little bit earlier, but the title of this slide is Food is Greater Than Pills. So whenever possible, it's best to get your vitamins and your nutrients from your diet. Supplements like these pills are available if perhaps you can't get enough of a particular nutrient in your diet, but it should not be your first step in obtaining appropriate amounts of these nutrients. For most folks, if we can have a varied diet that contains a lot of fruits and vegetables and proteins, for the most part, you're going to get the appropriate amounts of vitamins and nutrients that you need. There may be some lab values we can draw at the doctor's office to check. Or if you know there's a particular nutrient that you just can't get enough of, sometimes calcium is that nutrient. Because if folks can't tolerate a lot of dairy, that's our main way of getting calcium. So then a supplement may be warranted. But in general, if you've got a pretty varied diet and you like to eat various foods, you're probably getting the amounts that you need. The next question to ask, did I talk to my provider? Did I ask my doctor first? Or did I just take it upon myself because Dr. Google told me that this is good for energy or whatever it might be? It is important to talk to a healthcare person if you can, whether that be your doctor, your other prescriber, or a pharmacist. And talk to them first about why you want to start on this supplement. Maybe you don't realize that you've become a target of these marketing campaigns before actually assessing your own individual health. Dr. Oz used to be a really popular guy, but he's not your doctor. That's what I always tell my patients. He's not your doctor. He doesn't know your specific health concerns. He doesn't know the specific medicines that you are taking. So by providing this general recommendation to the public, it could actually be doing some harm. So it's important that you talk to a healthcare provider who can review the medicines that you're currently taking. Make sure that there won't be any drug-drug interactions. Make sure that the ailment that you're trying to treat or prevent by taking this supplement isn't something more serious. Maybe your lack of energy is attributed to something else that a physician needs to assess. And just taking a supplement on top of it, of your other medicines, might not be the best choice for you. So talk to someone first. Next, always check the bottle for warnings or caution labels. So there may be warnings on supplements that relate to certain conditions you may have. So they may say, and maybe you've seen these on the backs of labels before, folks with a heart condition, talk to your doctor first. If you have diabetes, talk to your doctor first. So look for those. They can at least give you a little bit of guidance of whether or not a product may be something you really need to talk to a provider about first. So look for the warnings. And if you don't understand them, ask someone. Next, this kind of goes to our diet chat, but do you have enough of this already? You might be getting enough of a particular vitamin or supplement or nutrient in your diet already, and you don't need that additional product. Purchasing or taking an additional supplement might not be warranted for you. We often think more is better. That's not always the case. Sometimes taking too much of a particular nutrient or supplement product doesn't get absorbed in your body. You might see on the back of a vitamin label or a supplement label that it contains like 400% of the recommended daily amount. And you might think, that's great, I want more. More is better. Your body might not even be able to absorb all of that at once. And then you just pee it out. And we're paying for expensive urine if you're just taking all these products that your body might not even be able to absorb. So assess what you're already getting before we look at supplementing it. If you do decide to take a product and you talk to your doctor or pharmacist about it, do you know how much you're supposed to take? So because these are specialty foods, the serving sizes are more like serving sizes you might see on a loaf of bread label or a nutrition label or something. They're not necessarily the recommended dose for you. They try to speak in generalities. And so that can be a little difficult to really decipher what's the appropriate dosing for me. And sometimes they'll say, this is your recommended daily dose, but it doesn't take into account what you already get in your diet. So if you think you need 1,000 milligrams of a certain supplement, but you already get 800 milligrams on average in your diet, You don't need 1,000 in a supplement. You'd only need 200 to make up that difference. So there's a lot more that goes into it versus just this is the recommended amount. Recommended for who and based on what? As we alluded to, taking too much is not always better. So not always that you're already getting enough and you're just going to get rid of it or eliminate it through your urine, but sometimes too much can be harmful as well. It can be dangerous for some folks who have certain medical conditions, or maybe you already have a lot in your diet and you end up taking a lot in a supplement. Too much of a good thing can sometimes not be great. The good thing about some of these supplements is that for the most part, taking too much will just be eliminated naturally in your body, but that doesn't mean it's without side effects potentially. So this is what a lot of these questions are asking in the chat. How do I choose a product? Or I take this product already. Is this one okay? And while I can't really provide specific recommendations to an individual, I can't provide medical recommendations to you without sitting down, going through all of your health history, the same way Dr. Oz can't say this is good for you because he doesn't know you. I won't be able to necessarily say yes or no for a lot of the products that folks are asking about in the chat, but I'm hoping to give you some guidelines that you can follow or good recommendations on how to choose a product that might help you in the long run if you were to assess a product you already have or looking at a product that you hope to purchase in the future. So, considerations when you're selecting a product. Vitamins and supplements, again, do not undergo FDA approval the way that OTC products do. So the US government has almost no control over these supplement manufacturers. They're not required to be proven safe. They're not required to be proven effective. And often when they're trying to promote their benefits, they're going to try to make it sound better than it is. However, the good thing is it's illegal for them to make those claims that they treat a disease. If we are savvy consumers and reading what they're writing on those products, we can choose a product safely. So this is something that's actually really important. If you take anything away from this presentation today, this is what I hope it is. Looking for something called USP Verification. So that stands for the United States Pharmacopoeia, and it's an organization that is a third party that essentially they are available for products or brands to undergo voluntary review by a third party. So this organization tests products to review their manufacturing practices, their quality control documentation. They do laboratory testing of samples and supplements. And after something's promoted and on the shelves, the USP will also take it off the shelf and do what we call off-the-shelf testing of the products they've already verified to confirm and continue to confirm that they continue to meet these science-based quality standards. So if you see a USP verified mark on a dietary supplement, you can be sure that the product contains the listed ingredient on the label and has the declared potency or strength, and the amounts are accurate. So there's a quote here. They say, it helps assure that customers are getting the value that they expect from a product that they are purchasing. So additionally, USP verification ensures that products do not contain any harmful levels of other contaminants, which is a good thing. It also helps ensure that it will break down and release into the body within a specified amount of time, because if a product doesn't break down properly, you don't get the full benefit from it. So they're not just saying, does it have the right ingredient? They're kind of starting to check, does it actually work? Or should, based on the way it works, will it give us the benefit that we hope to see? It also ensures that they've been made according to FDA current good manufacturing practices. So that's making sure that they use sanitary and well-controlled products. This is a great question here. Are there any fake USP certifications? Great question. Not that I know of. It would be not something that you could really obtain. So if it has that mark, you can trust it. So here's what it would look like. That USP in the top right So I see some people might have some bottles with them. That would be the stamp that you're looking for, the USP Dietary Supplement Verified. There are over 100 different dietary supplement formulations that have received that USP verified mark. There are multiple brands and different retailers. Some of the super common ones, though, that we can find in a lot of places are Nature Made. And then Kirkland Signature, which is actually the Costco brand, is often a lot of their products have that USP verification on them. I put a few others on there as well. Members Mark is a common one to find, but Nature Made, I think, is a good go-to. If you go to the USP website, they also list a bunch of different products. So vitamins, minerals, multivitamins, other dietary supplements. And you have to kind of be a little careful if you're looking on that website, because it will have the formulation. So a pill might be, but maybe their capsule isn't. Their 400 milligram might be, but maybe the 800 milligram isn't. So making sure that the exact product matches what you have. But the easiest way, look for that USP stamp. And this is also a reminder to check those warning labels. So if you find a USP verified product, you've talked to your doctor or pharmacist and you think, yes, I could benefit from this, we've determined the right amount that I need, always look at the warnings just as a double check. So the supplement facts on the back, which kind of looks like a nutrition label, right? The supplement facts will show you the intended ingredients, the amounts of those ingredients, and then that recommended serving size. Always use caution though. See if there's any warnings about concerns with chronic conditions, concerns with other medication, things like that. So one example here I put, this is a turmeric supplement. The suggested use is 1 capsule daily with water and a meal. And the caution on here that I think is important is do not take if you have a history of gallstones or bile duct obstruction. If you are taking medications or have blood clotting issues, consult your physician before use. Someone might see turmeric and think, that's just a spice. I use that in my cooking. What could be the problem? I'm going to take it. But there are actual real potential medical considerations that we have to take into account. So don't always assume it's safe just because maybe it's a spice or it's available over the counter. Always give it another look. So here's another topic to talk about with this, this general topic of media attention surrounding our vitamins and supplements. So television advertising is important to take a look at. So just as the government has no control over the product itself, there's very limited control relating to the advertising or the claims that are made by these manufacturers. The US is one of only 2 countries in the entire world that allows direct-to-consumer advertising for pharmaceutical products. So that's a little bit different than maybe our supplements or vitamins, but it goes to show that we expect to see these things. We're not surprised when we see advertising on television. So while, as I said, dietary supplements don't always fall into this category, we're used to seeing it pretty regularly. I might see an ad for a dietary supplement and think, yep, it's just like I see those prescription drug ads on TV. So it must be safe. It must be good. You need to be a savvy consumer of media as well. So when we are trying to critically assess our product labels and advertisements, we need to be aware of these exaggerated claims, these super bold promotions, talking about these miracle stories. If they state how many products they've sold, why would they need to do that? Does your allergy medicine say we've sold this many products? Does the ibuprofen that you purchased tell you how many people have purchased ibuprofen? No, because the drugs work, so they speak for themselves, right? And they hope you're only going to take them if you need them. Why would we want these promotions and claims for these other products too? So let's look at this example. I would bet there's a handful of folks, if not more, on this call who either have seen a Prevagen ad or were questioning whether they should take it, or maybe they take it. I've been to a number of resident apartments at various Era Living communities, and I'd say maybe half of them have Prevagen in there. I understand why. Look at this claim: healthy brain function, sharper mind, clearer thinking. Who doesn't want that, right? But they also will say on the back here that it's clinically shown to help with mild memory problems. What do they mean by clinically shown? What sort of study did they do? Was this something that is the same kind of study that like my allergy medicine goes through? They don't really tell you. I don't know what this clinically shown evidence is that they have, if it even exists. They say they have safe and clinically tested ingredients, but I don't actually see a third-party marker on here to promote safety. They also say here at the bottom, it contains apoequorin. Anyone know what that is? I don't, and I'm an expert in this field. So a lot of times these big words might make us think, oh, this is fancy, this is special, it's got to be good. But we can't always trust what they put on the label here because no one else is looking at it to make sure it's safe. No one else is looking at it to make sure these claims are true. So I think that's another example of how we need to be pretty savvy. And while we might really want the benefits that these products are claiming to provide, it might not always be what we hope it will be. So look here. If I looked at this label, I see it's kind of complicated. They use some technical terms. They almost provided too much detail, but didn't really give me an actual sense of what they were doing. Like they said, it's a double-blinded, placebo-controlled clinical study. It improves certain aspects of cognitive function. But they didn't really tell us what that means. I think they're trying to use some of these terms to really draw us in. But again, in the same way that if there were this magic pill to help with our memory, wouldn't we all take it? Wouldn't everyone be taking it? Would we put it in the water? You know, if those things truly existed, it would be, they wouldn't be afraid to undergo third-party testing. We would actually see other studies and publications supporting it. So often I say, in general, Prevagen is not dangerous. Again, you always want to double check if there are any drug interactions. It's not dangerous and it's not likely to cause harm, but the benefit is questionable. Next, we'll look at another label. Here's one called Athro 7, a healthy joint support. So here they say it is, quote, clinically proven, shown, tested. They use these terms to try to sound more scientific. But how did they test it? How many people was it tested on? What methods did they use? How many people actually saw this result? Was it just one that was shown to work? We don't really have a lot of data there. Additionally, they say it's doctor recommended. Okay, but whose doctor? Is it my doctor? Dr. John E. Hahn is a DPM and ND. So that means he's a doctor of podiatry, so a foot doctor, and a naturopath. So if that is a doctor that you trust, great, but make sure that you're checking in on that. He just says here it's supported by a UCLA researcher. So they're really trying to pull these things in and make you think, oh, we're fancy, we're good, you should take our product. But again, why would a supplement like this have to promote themselves so much if the product actually worked and it should speak for itself? So again, who is this doctor? What are his credentials? Doctor recommended or even pharmacist recommended doesn't always mean that all doctors or all pharmacists think it's a good option. And it's best to talk to yours, who knows your specific history and health concerns. Here's another one. Clinical Strength Neuropathy 900, a nerve support formula. This one here says it has 18 herbs, vitamins, and minerals. More doesn't always mean better. So 18 ingredients, well, what are they? Do they each have a purpose? I'd want to assess what ingredients are included, know what the intended purpose is. More is not always better. I like to avoid mixture or combination products whenever possible, because if you have a side effect from it, we can't really tell which product is causing that side effect. Same with like cough and cold products. We don't necessarily want to take one that has all the ingredients. If you only have a cough, you only need to treat your cough. You don't have to treat the non-existent congestion or vice versa. So just trying to go for the one product that you are in need of without the combination is best. So 18 herbs, vitamins, and minerals doesn't always mean better. It also says clinical strength. What does that mean? It doesn't mean that it's an equivalent to an actual drug that's intended to treat something, because we don't even know what they're saying they're trying to treat. So clinical strength is one of those terms that's trying to get you to think perhaps it's better than it is. Remember, dietary supplements are not drugs. So when we're talking clinical, we're often talking studies that we see with drugs. Here's a few more examples. Pure green coffee. So this was one of those that was pretty popular, and one of the offshoots of a thing that was made popular by Dr. Oz, claiming to promote weight loss. But actually, it's not FDA approved. And there were studies that showed it increased insulin resistance, which we know with increased insulin resistance, we often can see weight gain. So in a product that's claiming to provide weight loss, a study on it showed it could promote weight gain. So again, just an example of how it's not always what it looks like it's going to be. Pure Green Coffee was actually recently involved in a settlement for $9 million in a lawsuit with the Federal Trade Commission because they made false claims. So luckily you won't see this out on the shelves with those claims anymore, but it doesn't mean that there aren't others that we just haven't caught yet. Next, Garcinia Cambogia, another magical weight loss supplement. But actually they did a study on it back in 1998, and it showed there was no significant difference in weight loss compared to a placebo. And a placebo is just a sugar pill, like a fake drug. So they claim that it's effective weight loss, but they actually studied it and it didn't. Next, raspberry ketones, another one of those offshoot magic weight loss fat burner products. But in real life, there's not enough scientific data to support any of the claims that they made. And there are some concerns with taking this product if you have diabetes, high blood pressure, COPD, or asthma. So again, always use caution. Red palm oil is a vitamin E supplement that provides a claim of longevity. And they put little comments in there about preventing dementia or Alzheimer's disease. But again, in reality, there's no significant difference in the probability of progressing to Alzheimer's disease when using this versus a placebo. So the bottom line, dietary supplements are not risk-free. So should I be taking any dietary supplements simply because of my age? Because our goal here was to target older adults in the community. That's the only thing I can really assume about anyone's health at this given time is their age. So that's what we'll go off of. So here are some essential vitamins. Our bodies need these 13 essential vitamins. They do different things for our bodies. They help the body function properly. They help your immune system fight off infection. They keep your nerves healthy. They help you get your energy from your food, and they help your blood clot appropriately. So, excuse me, all these vitamins, vitamin A, C, D, E, K, and a variety of B vitamins are essential. Our bodies need them. That doesn't mean you need a supplement for all of these. You're likely getting enough in your diet. As far as minerals, they help your body function. Minerals are things that are found on the earth, often found in foods, and in our bodies do need larger quantities of the following minerals: calcium, magnesium, and potassium. So those are ones that your doctor might check your blood levels for, or you might want to assess your diet to see if you're getting enough. There are also things that if you were deficient in any of those minerals, you might be having some side effects or notice things are happening. So those are things you would bring up with your doctor, and they may or may not recommend an increase in those minerals. Again, first, increase them in your diet if you can, and then we'd look at supplements. Our bodies need smaller quantities of other types of minerals like iodine or fluoride. So again, everyone needs a different, or every mineral might have a different amount that our bodies need. Again, most people get enough of these minerals and vitamins by eating a balanced, varied diet. So let's talk about aging as far as this is concerned. So as we age, our diets often change. Our appetite might change, our activity level might change, how we use the foods that we eat can change as well. So older adults may need more of certain vitamins or minerals than younger folks do. But ultimately, your provider or a dietitian or nutritionist will be able to give you specific recommendations based on your individual health needs. But in general, there are some things that many older adults can consider. So let's take a look at a few of these specific vitamins and minerals. First is calcium. It helps keep our bones strong, of course, which is really important at any age, but especially as we get older, especially if folks have low bone mineral density or osteoporosis, or have had a fracture in the past. Calcium can help to prevent fractures, again, along with other medications or lifestyle habits. For some people, it can be difficult to get enough in your diet. Others, they're totally fine. So if you're lactose intolerant and maybe you don't eat a lot of dairy, maybe if you're vegan and you're not having a lot of dairy or animal byproducts, then you might not be getting enough calcium. But in general, if you kind of keep track of how much dairy and calcium you have throughout the day, that will give you a better idea of if you need a supplement or not. However, most older adults would benefit from a calcium supplement. The only risk with taking too much calcium might be some stomach upset, or if you've had kidney stones in the past, this might potentiate your chance of having kidney stones if you took too much calcium. But in general, even if you've had kidney stones in the past, taking the recommended amount of calcium, not a concern. So what is the recommended amount? So this is your total from your diet and supplements. So if you are 70 years old and younger and male, 1,000 milligrams per day is recommended. Men over age 70 would need 1,200. For women, we start at 1,000 milligrams per day, and once you reach age 50, we want you to have 1,200 milligrams per day. So anyone over age 70 should be getting 1,200. Women 50 and up should get 1,200. All right, next is vitamin D. So vitamin D we find in some foods, but it's really limited in how we get our vitamin D from foods. There's two types of vitamin D, D2 and D3. So D2 comes from our plant-sourced foods, D3 is from our animal-sourced foods. So again, if you're not having animal byproducts, vitamin D might be a little harder to get in your diet. But your body also makes vitamin D when you're exposed to the sunlight, which we've got a nice sunny day today here in Seattle, but a lot of times in the Pacific Northwest, especially September through April, we're not always getting a lot of sun. As we age, maybe our mobility becomes more limited, so you don't get outside as much and we diminish the amount of sunlight that we have. You might not have as much vitamin D. So a vitamin D supplement can be a good idea. Adults age 70 and younger should get at least 600 units per day, and adults over 70 should get 800 units per day. If you have a diagnosis of osteoporosis, though, they might recommend upwards of 1,000 to 2,000 units per day. And one of the reasons for this is that vitamin D helps our body absorb calcium. So if you eat calcium and you take vitamin D, it helps your body use that calcium better. This is a great question. Can your body create vitamin D from sunlight when you're fully clothed versus having some bare skin, like when you're on the beach? So obviously, the more skin that's exposed, we're going to get a little more vitamin D, but most of the time there's some skin showing. So even if it hits your face or a little bit on your chest or your arms or your hands, we're going to get some of that, that benefit. So don't think that in order to get vitamin D, you have to go out in a bikini on the porch to get the appropriate sun exposure. Wearing normal clothing, but having just your face or hands or arms exposed will still give you some vitamin D. This is also a good point. Sunscreen prevents vitamin D absorption. So what's difficult is we need to find that balance between vitamin D, but not risking too much exposure to UV rays that we increase our risk for skin cancer. So that's where supplementation can also be pretty helpful. So with with vitamin D, again, looking at how much you might get in your diet, take into account any sun exposure you have, but a vitamin D supplement is warranted for many older adults. Next, we'll get B vitamins, B as in boy. So first is vitamin B12. It does a lot of things for our bodies. It helps keep your red blood cells and nerves healthy. For most older adults, most adults, we need 2.4 micrograms per day. But as we age, The amount doesn't change, but our absorption of B12 changes. So we still need the same amount, but as we age, we might be ingesting the same amount of B12, but it doesn't actually get into our bodies to work. So we could have a higher risk of vitamin B12 deficiency as we age. Also, if you are vegetarian or vegan, there's a higher chance of vitamin B12 deficiency because B12 is only found in animal products, or there are some foods that are specifically fortified with vitamin B12. So if we look for those, we can try to get more in our diet, but sometimes a B12 supplement is warranted. So again, things to ask yourself before you pick up a vitamin or supplement product. Why am I taking this product? Is it because someone said it's good for you? It's good for my body. Well, who said that and good for what? Think about yourself as an individual and why you're actually taking this product. I think the most common response I get when I ask someone, so why are you taking this supplement? They said it was good. Who is they? Do they know you? Think of these questions a little more critically if you can. Again, have you talked to your provider or pharmacist about the product? Is it possible that the product could interfere with my other medicines or my other diagnoses? Is this product worth the cost? Is this product safe? And how do I know? I want to touch on cost real quick. So often there are supplements that folks will take that we can determine that they're not harmful, but they also might not provide a lot of benefit. Excuse me. If someone's really tied to it and they've been taking it for years and swear that it's beneficial, as long as it's not breaking the bank and not causing harm, I'm not likely to tell someone to stop it, but I'm not often recommending that folks start these new supplements because we know that there are other products or prescriptions possibly that will provide more benefit and have actually clinically proven benefit. Okay, so where can I go for more information? The Office of Dietary Supplements is an offshoot of the National Institutes of Health, and they have a lot of information about dietary supplements. The FDA, the US Food and Drug Administration, they have a specific offshoot called the Center for Food Safety and Applied Nutrition. All of these things can be found with a quick Google search or trip to the library. And then the USP, which is the United States Pharmacopoeia. So with that, I will open it up for questions, but I'm going to go back in this chat because there were quite a few that I wanted to just make sure I addressed as we went forward. So someone was just kind of talking about why these things are not regulated, and is it due to lobbyists to Congress to not have oversight? I actually don't know the true details in that. That would be interesting to look into. But again, a lot of it is because they are regulated as special foods, not as drugs. That's where the differentiation is. Are there any particular vitamins or supplements that are dangerous if you take too much? There definitely can be. Every product will have a maximum amount or a toxic amount, which again is why it's important to talk to your doctor or pharmacist about that to make sure you're staying under that amount. Some vitamins in particular that I think often we think if we take too much, we'll just urinate it out. But there are some that's not the case. In particular, ones that we call fat soluble vitamins. So those are D, A, K, and E. Taking too much of those, your body doesn't just get rid of them, they stick around in the fat in your body. So even if you have very small body fat, it doesn't matter. When you take those, they stick in your fat and can continue to have an effect if you take too much of them. So D, A, K, and E were ones we don't want to be taking 500 or 600% of the recommended amount, but you want to make sure that you're keeping track of the amounts of any products that you take. Someone here was asking about a particular multivitamin for seniors that they take, figuring it can't hurt, it doesn't cost very much, might provide something I need. Is this sensible, useless, dangerous? I think a multivitamin is often an okay recommendation for folks. But again, if you have a varied diet, you might not need it. But if maybe your appetite's changing or you've decided there's certain foods you're just not into eating and you think maybe I don't have a well-balanced diet, a multivitamin could be beneficial. But again, I would look for a USP verification if you can, and always run it by your doctor. Let's see here. So those few that we talked about, like the biotin, glucosamine, chondroitin, are they useful? Possibly, but again, now that we've been through kind of the whole presentation and seeing like what questions to ask myself, how do I talk to my doctor? Is it worth it? They may or may not be useful for you. The safer brands, again, would be those with a USP verification. So here are medical grade supplements better. That might actually be one of those claims where they're saying it's medical grade, but what does that actually mean? The ones that I say would be better are USP verification, or sometimes providers can write a prescription for a supplement or over-the-counter product that gets filled in the pharmacy. And sometimes they will purchase products that are an over-the-counter strength, but they do it as a prescription product, and then it comes from an FDA-approved manufacturer, but not all of them are available. And if you have Medicare, they don't pay for over-the-counter products. So you'd be paying the same amount, have to get a prescription. It's a little extra step. So looking for USP is the number one recommendation I'd have. Someone here, I think we can safely say not all FDA-approved meds can be dangerous, or so there's always risks associated with FDA approval and with meds that may have FDA approval. But what the FDA approval does is prove that it contains what it says it's going to contain. They monitor the practices for manufacturing to make sure there's not contamination in the warehouse. They monitor the products after they're implemented and look at them and say, are they still safe? So if we don't have any body that is helping approve that or maintain that, it's a lot scarier. So while there can always be risks and benefits associated with any product, even if it gets this approval, we at least know that there are safety and quality standards that they need to be held to. So hopefully this question here about calcium and vitamin D was answered. I think those are great products to take for bone health. And again, just assess your diet. Someone here says, is it true that absorption of vitamins and minerals may decrease as we age? Which, yes, that can happen. So even though the amount recommended is the same, we might not be getting that full benefit. Unfortunately, I can't really speak to any specific products that folks have listed. I would recommend you chat with your doctor or pharmacist. But hopefully you've learned some tools here to help you select a good product. Someone here asked if I would address the new popularity of sleep aids. There's data perhaps showing that melatonin may not be as safe as we've been led to believe, may have unanticipated side effects. Anything with long-term use might come up with additional reports or concerns with side effects and that sort of a thing. Again, I think it's best to speak with your doctor specifically. They might not be experts in the field, but they'll at least be able to help point you to good resources, to the actual data rather than someone else's interpretation of it. As far as melatonin, it's one of our safer sleep aids for older adults. Actually not recommended as we get over age 65. Melatonin, the way that it is for those with jet lag, or if we're like, maybe you're going from working nights to now working days and you need to change your schedule, that's where melatonin has been the most helpful. And short-term use is usually when it can provide the most benefit. So as folks start to use it differently than that, we might see more data come out with different side effects and things. I think that question was answered with the USP certification. Great to see that someone always checks with their doctor for vitamins and supplements. Again, I can't speak to any specific brand and products, unfortunately.
Your sound is gone.
It looks like Abby's connection might have frozen. There she is.
Sorry,
again.
am I back?
You're back.
I'm so sorry about that. Someone was asking about being vegetarian. And and wondering if they have enough vitamins that they need if they do eat eggs, milk, and fish. And most likely, yes, folks who are vegetarian can still have a very well-balanced diet that contains the nutrients they need. And since you do have some animal byproducts, your vitamin B12 is likely to be appropriate as well. Fish oil, that's an interesting one. So we know that fish oil can really be beneficial for heart concerns and our cholesterol, but you want to make sure that you're getting the appropriate amount. And again, a USP verified product. So we really need to look at the amount of EPA and DHA in our fish oil products, and the ratio needs to be appropriate. So your pharmacist should know that and would be able to help you out in picking a product. So this is great. Going back to the question, what's the correct answer with vitamins and supplements? Helpful, harmful, hype? I think some that fall into each category. Definitely some that can be helpful, definitely some that are harmful, and some that are just hype. So hopefully you've learned some tools and tricks here to help you select good products and be a savvy consumer. And then here, what about protein powder? Is it safe? I can't give a blanket statement for that. Again, they don't always undergo certain regulations. There are some products that do have testing of their protein powders to make sure that they're appropriate. So that would be something to talk to your doctor about. But again, if you have a well-balanced diet, you might not need a protein powder. I would go to your diet first if you can. Someone here talking about vitamin D, that there might be data to show it helps with intestinal issues too. So yeah, a lot of times these products will have multiple benefits too. So that's good to know. We're kind of trying to stay up on the times and the new stuff that's coming out. So I think I've touched on all the questions. I'm a minute over and I apologize, but is there anything else that folks have questions about, or Ike, if we need to call it, that's all right too.
Does anyone else have any questions? Lots of thank yous, and this was great.
Yeah.
If we do get further questions after the fact, I will go ahead and email those to you, Dr.
Great.
Winter, so that you can take a look at those.
Yeah.
As we really don't seem to have a lot more questions, I just want to say thank you again on behalf of University House and Era Living. It is a pleasure to have you talk, and I think we all learned a lot today. At least I know I did. I just want to also remind everyone that we will be sending a follow-up survey to you, and we would love to have your feedback on this presentation, as well as anything else that you might like us to bring you in the future. And with that, my name again is Tina Hall, and I am the Business Development Manager at Era Living. And I think this is going to conclude today's presentation. On behalf of Elliot, myself, Ike, University House, where life goes on and lifelong learning thrives. Thank you all very much for joining us today, and have a wonderful afternoon.
Thank you, Dr. Abby. Thank you, Tiva.
Of course. Thank you.
Thank you, everyone.